So we went to Manali. It's a town in the north of India, in the state called Himachal Pradesh. Himachal means the lap of the Himalayas. So it's the very start of the Himalayan mountains. It's a 14-hour bumpy and very scary drive from Delhi. And it serves about 30,000 people, that town. So the town itself is only 12,000, but there's a mountain which we'll show you in a second that is very diverse and very varied in its type of people. It's near to both Tibet and Nepal and has a huge immigrant population that presents some very specific issues that we can talk about later to the treatments and hospitals care. I want to show you a picture of where their place actually is. So this is literally the view from about 2 k's out of the town. That's the town, and that's the whole pass. The patients that come here are not just from this town, but in fact are from 2 valleys that are past that mountain range. So we were there just at the very start of winter and got to see a very interesting mix of patients who actually can't come back to this hospital for the whole time during winter because the passes all get closed off and there's nowhere to open up. So it changes the way you think about providing medicine. When you think about rural Australian who's maybe 15 hours from Brisbane, they will be able to get medication regardless of how far they are. Something will be done to get them their medicines. These folks, that is just not an option. So it did change very much the perspective with which you treat. So keep this in mind because it will inform a lot of the stuff that we talk about with respect to the hospital.
Sorry, I'll sit on this side. So just as a bit of a background for healthcare in India, to sort of put a bit of, I guess, the hospital's role in healthcare into perspective. So just a bit of figures. So health in India, the total expenditure is about 3.9% of their total GDP. And when you put this into line with places like Australia and the US, it's just sort of doesn't even compare. Like it's just such a small expenditure. So India is quite similar to the Australian healthcare setting. They have a public system and then they have a private system. India is a very, very diverse country. They have some of the wealthiest people in the whole world and they have some of the poorest people in the whole world. So these government hospitals suffer from all the same issues that I guess our government hospitals have, but just on a bigger scale. When we talk about overcrowding and no beds being available, overcrowding is 4 people in a bed as opposed to 2 people in a bed, and patients sleeping on floors, and waiting times, just insane waiting times, and no staff wanting to work in these rural hospitals because, like in Australia, they don't have the training programs, and there's just no real incentive to sort of stay anywhere sort of outside the big centres. So not only are they under-resourced, but they're understaffed. So when you sort of put this into perspective, about 1 in 10 people in India has private health insurance. So in a country of 1.2 billion, 90% of those people are relying on these free government hospitals. And so as a result, only a quarter of women in pregnancy receive antenatal care, which is sort of just put it in there because it's a pretty sort of basic service, and one that we'd assume that everyone in Australia would get.